Sharon Chemister. My current position at Liverpool Hospital is after hours senior nurse manager, which is virtually the operational management of the Liverpool Hospital in an after hours environment. I'm an emergency nurse, so I worked in emergency departments for about 20 years, and I've been in senior management positions for the last 10 years in St Vincent's Hospital, and I worked for Justice Health, so I've also worked in the prison system out at Long Bay, Children's Hospital at Westmead, and now currently Liverpool. The target used to be 8 hours in the emergency department to an inpatient bed. In the last couple of years it's changed to 4 hours. We get between 200 to 300 people a day through the emergency department. Out of those, between 30 and 40% will be admitted. When people come into the hospital, they're given a number, 1 to 5, based on the severity of their illness or injury. Category 1 is life-threatening, so they have to be seen immediately. Because Liverpool's a tertiary referral centre, the highest acuity comes here. They'll bypass peripheral hospitals to come to the major tertiary referral centre because the smaller hospitals haven't got the resources and the experience to meet the demands of that patient. So probably the public don't understand, there mightn't be any ambulances at this little hospital. That's because they've all come to Liverpool because that's where the critical patients come. So the media is only allowed outside the hospital. They don't come inside. So if they can see 12 ambulances lined up in the ambulance bay, they're going to say that there's 12 ambulances there that are unable to offload. Maybe half of them are waiting for their next job, so it's a perception. Yes, there's 12 ambulances at the hospital. Half of them could be offloaded. One might be collecting patients from around the hospital to take them out. It doesn't mean they're all waiting to be offloaded. It is frustrating because everybody's doing their best and works so hard to look after the patients, and for us always patient safety has to come first, and also I think we don't get an opportunity to express anything. If anybody comes onto the media, it's going to be the health minister. It's not going to be us. So yeah, that can be frustrating for the staff when they've worked their butt off all day and then they go home and see criticism on the TV about their workplace. We're always trying different strategies to improve getting our patients into beds as quickly as we can, because we already know the longer people are on an ambulance trolley, they've got an increased risk of having a bad outcome. I've seen the change in the ratios for workload for nurses, and that was with the previous government, and that was to do with the Nurses Association really, because remember, nurses were looking after 10 patients, and they pushed very hard for many, many years to get nurse-patient ratio to 1 to 4. So yes, I have in my career seen a change there, thank goodness. So that would be the biggest change I've seen is nurse-patient ratios. More resources definitely over the years. I wouldn't say any particular government, but I've seen, attached to units now we have educators, clinical nurse educators, we have clinical nurse consultants. So there's people around. For instance, the new grads, there's new graduate coordinators, so there's a lot more support for the up-and-coming nurses. Even though the waiting times might be long, patient outcomes are far better than what they were, and people aren't dying like they used to in emergency departments. So the education, the training, the nurse-patient ratios, all of that has improved the quality of patient care. So that's a good thing. That's what we're aiming for.